So my name is Joanne Mwangi. For those who don't know me, I run a company called PMS Group. We're a communications company. We like to deal with brands that we develop and make them into the best loved brands in the world and make sure that their stakeholders make a lot of money and also do good for their communities. And in my panel, I'd like to introduce Professor Gedhu Muigai, who needs no introduction. I think you all know him. Professor Muigai has been the Attorney General of the Republic of Kenya. He is a learned professor and has, when it comes to health matters, teaches about patience because he has worked with politicians. We also have got Caro Musyoka, Dr. Caro Musyoka. Caro is a lawyer by training and a banker by profession. Currently, she's a corporate governance specialist working on very many boards in East Africa. She's a very well-known name in Kenya. And as you all know, when you read the papers, you find a lot of witty articles that she writes. And then, of course, today we have the authority in the room. That is Dr. Frank Jenga. Dr. Frank Jenga is the #1 guy who is known as the doctor for the mind. There's nobody in Kenya who doesn't know Dr. Frank Jenga because the first thing is that he's the founder, chairman of Kiromo Mental Health Hospital. He has been practicing for over 40 years, and he will be telling us a lot about mental health issues and how we should be coping or could cope better in this time of COVID-19.
Today's presentation is titled, What Does Your Mental Health Matter? I hope at the end of this evening, I will have persuaded you that indeed without good mental health, you are what an old friend of ours used to call bure kabisa, because you are really nothing unless you're mentally able to look after yourself. Now, for a number of reasons, this COVID-19 event is completely new, and anybody who pretends that they know the answers to the very difficult questions that are being put before us is either an extremely clever person or more likely an idiot or a fool, because really we haven't seen anything like this. If you look, for example, there is not one event in history, in my recollection, that has caused the entire world to come to a standstill at the same time. Different populations have gone into some measure of standstill, excuse me, at different times. But the last 3 months have shown us that it's possible to press the button stop and the entire world will stop. The second thing is that I think in my recollection, this is the very first time that the world can be said to be completely united. The entire globe is united in fear. And every person everywhere in the world is afraid that either they themselves could get this virus into their bodies, could get a loved one into these situations. So there is unity in fear. And the last thing that is completely new is that the enemy that we are fighting so gallantly is completely invisible. We can't see where this enemy is. So we are all in many ways fighting in the dark. Some people say, oh, we need an antibodies test. Oh, we need to check on this virus. Oh, we need to open schools. Oh, we need to close schools. Oh, next week is a better time now. Everybody has an opinion. And to some extent, the louder the opinion, the poorer the quality of that opinion. So I think this is a unique set of circumstances that we all find ourselves in. Now, let me say this, members of our club. The World Health Organization, almost in a panic last week, released a report on all the things that I have said just now. And as you can see, the people at the greatest risk are people like myself, frontline health workers. It's unusual to have the generals in any war be at the front line and be the ones at the greatest risk. Generals usually are clever and they send young and fit men and women to go and do battle. In this case, old men, including members of the club, have to stay up at night to receive patients in all sorts of places, and they're in great danger. Old people, for the reasons that are quite obvious, they are more likely to have hypertension, diabetes, and other things like that. Adolescents, as I'll be showing you in a little while, are in greater risk anyway. People who have pre-existing conditions like excessive use of alcohol, excessive weight, and so on. And finally, the World Health Organization tells us people in areas of conflict, people who live and work in the borders of our country are in great risk. Now, it took the Secretary General of the United Nations to say what we all know. And we all know, although we don't say it because sometimes it's not a good thing to say, and these are his words, and in my own family have been close to many doctors and psychiatrists treating these conditions. He confesses and confirms that within his own family, he has had to deal, even before COVID-19, with different types of mental disorders. Anybody who is in this symposium, with this webinar, who doesn't have a friend or a relative who has had a mental health issue of one sort or another, is welcome to leave or forever continue with this. Now, this before COVID came, last year, for example, it cost the world $1 trillion US dollars to not diagnose and treat depression. Carol will probably be telling us what 1 trillion is in number of zeros. So please count those ones because there are very, very many indeed. Now, for those who are tired or had enough to drink, I'll just give you 3 facts that you can take home, and I'll be quite happy if you do that. 264 million people today are estimated to be suffering from depression. If you take mental illnesses in general, that goes up to close to 500 million. And the truth is that in a family of 5 people, 1 member of the family will have a mental disorder of one sort or another. When we hit 100 participants this evening, what it will mean is that out of the 100 who will be with us, 20 will have one form of mental illness or another. That is if Karen has people who are normal. If it doesn't have normal people, the numbers could be either a little higher or a little lower. The second fact I'd like you to take home is the following, that mental illnesses in general start early. They start, half of them will be present before the age of 14, meaning by the time members of Karen send their children to high school, the ones who are going to develop mental illnesses have already got those illnesses and are recognizable. The fact that the members of Karen don't take them for assessment and treatment is the evidence of their ignorance, not of their knowledge. 75% of all mental illnesses make themselves manifest by the age of 24, meaning that 75% of those illnesses will occur at about the time or just before the time people are at high school and at university. So boys and girls who have problems finishing university or high school very often is on account of their having one or other mental illness. And finally, in the event that you see in the newspapers or hear somebody somewhere between the age of 15 and 29 died by suicide, not committed suicide. People commit adultery, people commit crimes, people die by suicide. So suicide among 15 to 29-year-olds is the second leading cause of death in that particular age group. So what the report continues to tell us is that many people who played golf regularly, played tennis regularly at Karen and were very happy having a few drinks and going home and were just normal folk, this COVID-19 thing, as it has come to attack us, will lead to previously normal people to develop one form or another of a mental illness. And I'll be talking about that in a minute. I know for sure that there are a number of you who are having one or two drinks this evening. That is, it should be, because I think the club needs to survive. But I want you to understand that at the very least in formal studies in Canada and other places, the number of people who are drinking alcohol excessively has gone up, continues to go up, and is one of the indicators of the presence of some of the conditions that I will be talking about. Now, I have been asked by people without number about what they should do about the fears that they have. I want to confirm that if you're feeling apprehensive, if you're feeling afraid, if you are losing sleep a little bit at night, if you're afraid that a member of your family could die, that is because they might. So therefore, you are normal. What is abnormal, and I keep saying this, is not you. It is the virus that has come to invade our privacy. Now, if the only thing we are going to be confronted by was death, there are some who are not afraid of death, wanasema oh, ni wanaume, things like that. But the real serious problem is that we are losing more than health. We are losing livelihoods. We are socially isolated. I really miss Wednesday at Karen in that corner, and those two nice nyamas. So I'm so sad. People have had to do things like stay at home. Many people will confirm that they married to be with their people for long periods of time, but not lunchtime, breakfast time, evening. It's not even healthy. No space. And that is why we come on to the next slide, which is right across the world, from the east in China, across to Italy, Spain, France, the UK, and America. There have been noticed increase in cases of violence at home, directed mostly at women, but also directed at children who will not eat or do their homework very quickly, but also, and this I look at myself, at the elderly. I think people are taking great advantage of the elderly, and I think the whole domestic scene is something else that we need to think about. Now, we have all seen people from space, at least they look like they're people from space, taking bodies of our loved ones and taking them in bags that look, I don't know, like, and then throwing those dead people inside holes, covering them quickly and running away. That is 100% un-African. We people of this country like to bury our people in a dignified environment. Dignity has been taken away from many of the things. I hear Motahi Kagwe and other people who I know well telling us, don't go to church, don't shake hands with the people who are your friends, don't hug them. This is complete nonsense and alien to us. These are the real things that are causing us serious issues. So why are we having this webinar today? We're having this webinar today because I would like to propose to you that much as we have accepted to wash our hands, even when they are not very dirty, much as we have been told and accepted that we shall keep safe distances from each other, we can flatten the curve that is expected to represent an increase in mental illnesses. How do we know this is likely to happen? We know that because it happened after many other disasters, the Spanish flu, the Black Death, the world wars, the financial crisis in 08. We know that suicide rates, particularly after the financial crisis of 08, went up. We know that substance use disorders, alcohol and other drugs, those ones went up. We know that rates of anxiety and depression went up. So I would like to recruit members of our club to consider participating in activities that could reduce, flatten the curve, if not only in members of our club, but also in our society. So consider this as a recruitment drive of one sort or another. I'm going to scare you a little bit because I think you've had enough drinks now. Suicide is the second, I've told you that, the second leading cause of death amongst young people. Which means, translates to the fact that 800,000 people die by suicide every year. Meaning, I don't know how many seconds I've been talking now, one person dies of suicide every 40 seconds. Keep counting. Now, we spend a lot of energy, a lot of time at the UN, I don't know where, everywhere else, talking about, oh, we must stop these wars, oh, we must stop. Let me tell you that there are more deaths from suicide than from all the wars that are fought, together with the homicide that we all try to prevent, put together. So if there's a way, any way you want to save lives and make sure that people stay alive, work on suicide, work on it at Karen, work on it everywhere else. And people keep telling me, and I say pole sana kwa sababu wewe hujui. They think that suicide is something of wazungu. It is not. Suicide, 75% of people who die by suicide actually live in low and middle income countries such as ours. And you can see the things they use. They use pesticide, they use dawa ya kunguni, they use dawa ya ng'ombe, they use all the common things that we find in our farms. So, and again, we can talk maybe another day about how strategies of reducing suicide include reducing access to dawa ya kunguni, dawa ya ng'ombe, and things like that. So, contrary to what Professor Muigai might think, it is not my intention to convert you into doctors or mental health specialists. That I will do another day. But for today, I want to talk to you about something really simple, straightforward that can be done. When a member of Karen falls down and injures their arm, their leg, whatever it is, the club has strategies for first aid. In fact, we have first aid boxes, and most of you are trained in first aid. I'd like to persuade you that it's actually possible to develop some skills in what is called psychological first aid. So what is psychological first aid? It's a very simple psychological intervention that respects the dignity of those people to whom it is intended. It is humane and offers very practical support. It requires that the person have been exposed to one form or another of a serious stress. COVID-19 is a very big stress for everybody, including the ones that will be giving this psychological support. And more importantly, and this has been shown over and over again, psychological first aid improves resilience and helps people to recover from adversity. The most recent studies on this one were actually following the SARS thing in the Far East, in Hong Kong and places like that. Those people who received psychological first aid actually did very well. Now, the principle number one of psychological first aid is exactly what your mother will tell you. Your mother will tell you, that's what I'm saying, it's common sense. Number one, look after yourself. Number two, get enough rest. Remember, you're also human. Mother will tell you, eat and sleep regularly. People need to hear these things. In times of a crisis like this, people tend to forget. Spend time with your family and other members of current club. All right? Very, very, very important indeed. So stay connected as we are doing now. Relax, play sports. Golf is a very important. Walking on the course is very good. Physical and so on. These are fairly standard things that your mother will tell you. Principle number two lives in the domain of common sense. Common sense in the sense that during these very, very difficult times, and I don't know whether the management will allow me to speak again in a webinar like this, avoid excessive use of alcohol and drugs, because they make you feel good for a short time, and then in the morning you wake up and you're feeling very bad indeed. Now, in the early stages of the attack, by this virus, a lot of people thought we had been sent home on a honeymoon, spent a lot of time in bed, I don't know, yes, just lounging about in pajamas and so on. This is the worst thing. This is not a holiday. And we have advocated repeatedly that people must continue to carry on some routine that is similar to what will happen when the country opens up again. The opposite is just as bad. There are people who have no time for themselves, for their families, for golf even. Remember, we are not angels and we need to look after our bodies. Remember the first principle, that is the lessons of what our mother would have told us. I know a few members of our club who have completely isolated themselves. They have locked themselves in the house, and some, I am told, sleep under the bed out of fear that they will be caught. You want to start laughing? So I think the human person has survived in the way that the human race has survived because we have interacted with each other. And I'm really very happy to see that the management and the board of our club has seen it fit to bring us together in this sort of way so that we can have a few words. Now, that is where I work. Many of you don't know that, but that is also true. That's really about all I wanted to say. Look after yourselves. If you're feeling a little bit anxious, you're feeling a little bit afraid, if you think that these are difficult times, remember, we the older people have seen many things in our lives. Even this COVID thing will come to an end. I thank you so much for allowing me to speak to you. Very good.
And Daktari, as you were speaking, I have an email here that I've received from Dr. Mwanzia, who's asking, what are the psychological effects to especially those who are laid off during this pandemic? It must be tremendous. They've lost jobs. They don't know what to do. And also, fear is a normal reaction. But how do we handle our fear so that we don't express it in ways that are hurtful to others? How do we protect teenagers from mental health, especially those who are candidates? How do we deal with these three questions?
If anybody pretends to know all the answers to the questions he has asked, either he's very clever or more likely he's a fool. We are all learning as we go along. The important thing is this. Those people who are well invested in social capital, those who have families that they can rely on, those people who have friends that they can go to, those people who prior to this COVID coming were well adjusted, are precisely the ones who are likely to survive this. If you were precariously balanced, either financially, psychologically, emotionally, or in terms of your family, you are the one that is likely to topple over. And finally, Dr. Mwanzia, let me say this. I have been in this space for many years. Look at my head. And I know this, that the majority of families in our land are good families, are able to look after their loved ones extremely well. So I am talking about a very important minority of our populations. We are a resilient people, and we shall go through this one. I hope that answers your question. If it doesn't, maybe somebody else can answer it.
All right, thank you very much. And I'll ask, after listening to all this, Dr. Carol, what have you thought about? What are the thoughts? What would you like to articulate in relation to what we've had from Daktari?
Thanks, Joanne. So first, let me disabuse you of any notion that I'm a doctor of anything, right? So, but I'm happy for the promotion, yeah? Mm-hmm. This has been thanks, Dr. Jenga. That was a really excellent presentation. And you've really localized it and brought it to our homes. And one of the things that as he was speaking, I think personally for me, why this time has been extremely difficult is watching a country like the United States completely go belly up, and they have filled us with propaganda. Now is when it's coming to fore. They run Hollywood, all our TV shows, all our movies, Armageddon, Independence Day. Any movie where there are aliens coming from space, it's the United States that will come in and save the day. And they are being a total mess. And so for me, who's a semi-control freak, what this period has done is just make me take stock and say, wait a minute, I've actually been brainwashed this entire time. There's no one country that's superior to the other. And to Dr. Jenga's point, we've been equalized. And, some countries are making a total cluster mess of it, and some are doing an extremely sterling job in terms of controlling it. So for me, I've definitely suffered from bouts of anxiety because, if you're watching a country like the United States struggle through this, and they have completely convinced me personally that they are the alpha and the omega of any problem that besets this world, then how will we even cope as a small country in East Africa? So that's really what's been going through my mind. And to Dr. Jenga's point, I have definitely been going through several bouts of anxiety and the Kubler-Ross model of grief, the 5 stages of grief, which is depression, first is denial, anger, bargaining, depression, and then acceptance, and then boom, back to denial, so I've sort of been zigzagging through that whole gamut of emotions. So it's been tough. It's been very tough, and I've enjoyed Dr. Jenga's presentation.
I've got a question here. People are asking, actually Evelyn Gitau is asking, precariously balanced financially or otherwise, isn't that the majority of our population? And can we start can that be the start of something you would add?
I actually don't know that all of the people who are members of Karen are precariously balanced. We are a world, a country, a club that has perfected the status of mourning and groaning, and we have forgotten what some of us were taught by our aunties in nursery school and in Sunday school, which is to sing the song "Count Your Blessings." Now, what actually has happened a lot, and this has happened where people have tried to count the number of people who are introspecting and getting into the habit of, as it were, or as they did in nursery school, sing "Count Your Blessings," has actually caused the levels of spirituality all over the world, the UK, which is where I know the study from, to go up. Meaning, Evelyn, that ordinarily we all think, oh, maybe a bigger car, maybe a better club. No, there isn't a better club. So maybe not a better club, but certainly a bigger house, better friends, and that sort of thing. But when you sit back and actually look and confront your lot and see where destiny has placed you, many people will actually feel privileged. Now, Joan, please allow me to say something that I was nearly forgetting to say in answer also to Evelyn.
Permission.
Thank you. There's a sense of something we call death by 1,000 comparisons. Death by 1,000 comparisons is a concept of, if you're only a millionaire, I wish I was a billionaire, I wish if you live in Rwanda, I wish I could. Always comparing yourself with, when you go to other places and you hear people talk about, all I wish God would give me is mafuta ya taa. I don't want a big car, I don't want a big house. All I want tomorrow is mafuta ya taa. So this whole question of precarious and balance is so relative that that it makes the conversation very, very difficult. Now, I have to say something about suicide because it's important. And if I don't say it now, I'll forget it. People don't kill themselves because they used to, people kill themselves because they have lost something. If you used to be able to afford mafuta ya taa, mafuta ya kupika, and you could pay your rent, and suddenly you cannot pay your rent and you cannot buy mafuta ya taa, that is what kills you. If you had a million shillings in the bank and now you suddenly find yourself with 100,000, that is the reason to kill. So it's death by 1,000 comparisons. It's when you compare yourself with the others that the real problems come. Evelyn, I hope I've come near to answering your very difficult question.
Thank you very much, Daktari. And I think, Professor, the wise man, has been sitting there listening to us and must have something interesting to say. So, Professor, as you speak, please, will you speak to the issue of us guys not being able to hug, to hold hands, to shake hands? Isn't this going to cause us to feel, I know you're not a medical doctor, to get depressed? Some of the things that are bothering, what do we do? I mean, come on, I want to hug.
I think an opportunity like we have today to discuss mental health is very important for our country. We come from a culture and tradition where we view mental health between 0 and 10, you are either sane or insane. And it is so important that Frank and his colleagues are able to remind us that between 0 and 10, there is so much happening. And this sort of pandemic reminds us that all of us are walking around looking normal, speaking normally, thinking we are behaving normally, but there are so many disorders in between. Carol spoke about anxiety, for example, and many other matters. And number 3, I wanted to raise also the question of how, as a former public official and maybe continuing as a teacher, how sometimes I always felt we were never grateful enough for what public servants do to protect and defend our collective interests. I am myself so impressed by what I see happening at ministerial level, at governmental level, the doctors, the nurses, the lab assistants. It's an incredible work going on. But again, even more important is to remind us how talented this country is, really. And not only, I think that I feel like if we were not distracted by other things, we could be sending teams like the Cubans have. Because on this continent, we are one of the very few people who have invested in learning, in knowledge, and so on and so forth. And we shouldn't beat ourselves too much. Now, let me come to what is happening between us as family, as friends, and so on. I think personally that we have had an opportunity to reset. We need to hit the reset button at many, many levels. At the levels of friendship, at the levels of family, at the levels of community. Things we've always assumed. I had always assumed for the last, God knows, 20 years, that every Wednesday afternoon, I will meet Frank, we will have a chicken pie, and then we will play golf, and then we will finish, and we will have 2 drinks. Not true, an assumption that has turned out to be baseless. I could go on and on about other assumptions, about family, about friends. So it gives us an opportunity to rethink our own lives and what is meaningful and what is not. And right now, I have found that there are many things I thought I never would need again that I truly need, like a person to take a walk with, alongside, because there is only so much walking you can do on your own. I hope that answers you.
Thank you. Thank you so much, Professor. Really profound and deep, I think for a lot of people, especially those of us around the club area, if you go to the club, you're finding a lot of couples walking, not always hand in hand, but walking together. And this speaks to this pandemic actually having some positives in our personal lives. Some comments from the chat box. Mr. Hassan Arrero, I've been hibernating as a person with underlying condition for fear of contracting this vicious virus. I think these are some of the things that people have been doing. Sam Mwai, our GM, hey, nice to see you here, Sam. And he tells me to give a shout out to Rosemary Dolan. So shout out to you, Rosemary. I really want to know the story behind that. And Isaac Lenaola, Justice Isaac Lenaola, thank you very much for being with us. Now, I'm going to launch my poll now, and I want you to participate so that we can all see what thoughts you have. So the poll is now published. Please vote. I don't think the panelists can vote, so don't struggle. The question is, overall in the past month, how satisfied have you been with your life? And the results are coming in. By the way, we've been up to 101 in terms of numbers, Dr. Frank, meaning that other than the four of us, Sam Mwai, Alison Giboine, Justice Lenaola, I don't know who the other crazies are. You know, you said there would be about 20 of us.
Okay, let's take the vote, and I'll describe that, and I'll discuss it a little more if you allow me to do that.
So on the vote, I've finished this particular vote and I'm going to close it. I've got the results. And now I will reset the vote and send you a different question.